Yes, you can. So the difference between the two is with Botox, it's actually going to relax the muscle of your lip temporarily to give the look of a more volume in your upper lip when you smile. However, it doesn't change the lip too much when you're at rest, and it doesn't last that long. So you can count on about 6 to 8 weeks out of it. It does require more maintenance, but if you're just wanting to like check it out, see if you like having a slightly larger lip, then it's a great option. However, filler is going to last you a lot longer. It will change the look of your lip and give you more volume and structure at rest and when smiling. So that's the biggest difference between the two.
Yeah, you can absolutely be treated the same day as your consultation. We just recommend that you allow at least 2 weeks before any special events or any vacations to allow yourself time to heal from any swelling or bruising.
Yeah, it is. We would be targeting the masseter muscles for that, so these chewing muscles in the back. In some people, especially if you clench a lot at night, if you grind your teeth, if you have TMJ, those muscles can get really big and bulky and create kind of a square jawline. So it helps not only aesthetically to slim that jawline when we weaken the muscle, but it also can help medically with those clenching problems. So we start off with a good dose and then reevaluate in 6 weeks or so to see if more is needed. But it does take time to see those slimming results as well, usually about 6 weeks, because it takes time for that big bulky muscle to weaken and see the change. But yes, you can do that with Botox or filler, but Botox is going to be what decreases the jawline. Filler would be adding to the jawline.
No, not all fillers are the same. In fact, that's a really good question. Most fillers are going to be hyaluronic acid fillers. And at Monarch, we carry over 10 different types of hyaluronic acid filler. The great thing is this is going to allow us to give different results for the different areas that we're treating, such as the cheeks. We want to create more structure or volume in the area. In the lips, we want a more natural, soft look. And then we want a filler that may fill in some really fine lines and wrinkles, and that would be a really soft, natural, smooth filler. So we have different fillers to provide different results, and you can talk to your injector at your consultation to determine what will be best for you.
That is a great question. I hate saying bad lip injection, but a lot of times there is always something that can be done. I always encourage, if you can, to return to that original injector who did the treatment. It's important for that injector to see those results and have the opportunity to address them. If for whatever reason that injector does not choose to see you again, or you don't feel comfortable returning to the same place, then yes, we're always happy to help you, and we can potentially dissolve that original treatment if need be, or just have a consultation about it. So yes, there are things that can be done. It depends on how much product was placed, what product was placed, when it was placed. So there's lots of things that will determine exactly what we can do for you. But I always encourage patients to originally return to that first injector if they can and if they feel comfortable.
Yeah, it's absolutely possible to get natural looking results with wrinkle relaxers and fillers. In fact, that's my goal, and I know it's Ashley's goal as well. We want you to look like a more refreshed version of yourself when you leave here, and really it is going to be based on dose, placement, just your communication with us, what you're looking for. And I know that I have told patients no at times if it's something that I don't feel like is going to look natural for them, and I'm sure Ashley can agree.
So for Botox or any neurotoxin, it takes 3 to 10 days to see final results. Some people respond quicker than others. So we typically like to wait at least 2 weeks before doing any sort of a touch-up, if that's necessary, because we don't want to go in and start chasing something if it's going to correct itself on its own. With fillers, you see an immediate change, however, it's not necessarily your final result because there is usually some swelling, there's some tissue trauma, bruising, so it takes time for that to calm down and really settle into how it's going to look. So again, I usually encourage waiting at least a week or two before addressing any lumps or bumps because it's typically just tissue trauma that's going to work itself out. So on most treatments, it's going to take about 2 weeks before you see that exact final result of how it's going to look.
Botox in the underarms will actually help decrease the amount of sweating in the treatment area. Results can last up to about 12 months with a treatment, and results take around,
I usually say about 4 to 6 weeks again to reevaluate and see if we need to add a little bit more. Absolutely, yes. There are currently 4 neurotoxins on the market in the US. Of course, in other countries, there's unlimited options, but in the US, we have Botox, which is the most well-known. We have Dysport, which is probably the biggest competitor to Botox. We have Jeuveau, which is the newest neurotoxin on the market. We offer all 3 of those here at Monarch. The 4th one is called Xeomin. It has the least amount of active molecules per unit of all 4, which is great for a very, very natural result, less of a freeze, but I don't want it to sound like the other neurotoxins make you look frozen. It all has to do with the dosing and the placement and the look that you're going for. So we do offer the Jeuveau, Dysport, and Botox here. And we always can talk to you about the little differences between them and what might be best for you. If you've tried one and it works really well, usually people stick with it. If there are little things that you're like, I wonder if something else is going to relax me a little more, if it's going to last a little longer. We have options to choose from. It's great to just try it once and see which one you like the best. I usually say it's kind of like Coke versus Pepsi. Both basically the same thing, but there's slight differences that make people like one more than the other typically.
Please leave us any comments or questions if you have any, so we can answer them at our next Q&A segment. And please follow us at Monarch Plastic Surgery.